health, it has been very exciting. We started off the week with a visit to an exhibition at the Marathon Mall. It was an exhibition on climate change, and it was co-hosted by the Pan American Health Organization. Many Bahamians are not aware that climate change impacts health in very real ways. We can think of the impact on our health facilities from the recent hurricanes, Matthew, Irma, and Joaquin. But it's more than that, because as sea levels rise, it changes what happens with the flora and the fauna. We see changes in the populations of bugs and animals that carry disease. We see challenges with our water supply. And so, given the fact that we are a small island developing state, we have serious concerns about the threat of climate change and the impact of continuous global warming. Very recently, we would have seen what happens when the water temperatures increase and you get an overgrowth of Vibrio parahemolyticus with the resultant problem of conch poisoning. Also this week, we had a serious discussion about the international pricing of diabetes medication. Now, we're fortunate because we get our medications at a very, very subsidized price. So vials of insulin of various types, which may cost as much as $100 or $200 a vial, are available in the Bahamas for less than $40 a vial. That said, since adult onset diabetes, which impacts almost 70,000 people in the Bahamas, is for the most part preventable, we would rather manage diabetes, not just with medications, whether tablets or injectable medications, but with prevention, diet, and exercise. And so we have engaged in a very active discussion to be followed by a national campaign for lifestyle modification. We were also pleased to see that the number of cases of Vibrio parahemolyticus conch poisoning has decreased dramatically. It hasn't gone away. There is still the occasional case. And I want to remind people that even though the message is getting out, you can eat raw conch, you can eat scorched conch, you can eat conch salad, but make sure that it's washed in water first. Finally, we had a most unfortunate situation with an outbreak of what we believe to be a viral illness at one of our major hotels. This viral illness is thought to be the Norwalk or norovirus and is often spread from one person to the next. There were many persons who suffered from gastrointestinal symptoms of nausea, vomiting, and diarrhea. Once we found out about this on August the 7th, our teams from Ministry of Health and Environmental Health would have moved in and coordinated activities along with the management and staff of the resort. We're pleased to say that as of today, that the challenge at that resort has abated. So it's been a busy week. It's been an exciting week. We have had discussions on the upcoming possibilities in medical marijuana, opportunities for farming, different products, all of which adds to the public's health. So I'm really pleased to let you know what we've been doing in health. We take it very, very seriously because the health of a people is the wealth of a people. And in the Bahamas, we take your health absolutely seriously. Stay tuned next week when we'll give you another update. Thank you.